Instrument cycles generally are the longest cycles because they have multiple rinse, wash, lubrication, and drying times to meet the instrument's cleaning needs. Basins and containers are generally run on a utensil cycle. Some washers manufacturers offer special cycles for delicate instruments. When running a mixed load of containers and instruments, the instrument cycle should normally be utilized for maximum cleaning. CS technicians should be familiar with different washing cycles and should be able to select the appropriate cleaning cycle for the items being processed. Some washer racks, manifolds, are equipped with irrigation lines that can be connected to certain complex instruments to add a channel flush to the mechanical cleaning process. See Figure 8.30 for an example of this. Chapter 8. Automated cart washers. Cart washers were originally designed to clean carts used for transport of various supplies and instruments. See Figure 8.31 for an example of a cart washer. Some cart washers are designed to process rigid containers and other miscellaneous items. Some models have programmed instrument cycles. Several manufacturers offer cart washers with design features and special washer racks to facilitate the processing of basins, pans, bedside commodes, and surgical stainless steel tables. Processing rigid containers, basins, and other transport containers in a cart washer can yield operational speed and efficiency. See Figure 8.2 for an example of this. Cart washers operate in a manner similar to automated instrument washers, but are larger scale. Spray arms deliver high-temperature water and detergent, and successive steps provide rinse water and hot air drying cycles. Cart washers resemble automated car washes in their cleaning process. Most cart washers do not have multiple phase cycles like washer disinfectors, but include a high-temperature process to reduce bacteria and facilitate drying. Detergents selected for cart washing should be formulated for use in cart washers. Important factors to remember when using a cart washer include: when cleaning enclosed carts, ensure they are approved to be cleaned by a cart washer. Older enclosed carts are not designed to allow water to drain from the interior, so the cart may be damaged by the lingering moisture. Do not process instruments in a cart washer that is not designed for that purpose. Do not process items inside carts. The walls of the cart washer will keep cleaning solutions and rinse water from reaching the items inside. As with the older equipment, it is important to test the cleaning ability of cart washers on a regular basis. Commercial testing products are available. Automated endoscope reprocessors. Some automated endoscope reprocessors, or AERs, have cleaning cycles as well as disinfection process. This equipment will be discussed in depth in Chapter 9. It is important to note the following when using the cleaning cycles. Only process items approved for processing in this type of equipment. All items must be manually cleaned prior to placing them in these units. Only use cleaning chemicals that have been approved by the equipment manufacturer. The equipment must be tested on a regular basis. Equipment testing. ANSI AMI ST79 10.2 recommends a quality assurance program to ensure that the mechanical equipment is working properly. Commercially prepared products can be obtained to verify the cleaning effectiveness of the equipment. See Figure 8.33 for an example of this. If the mechanical cleaner has a printout, the printout should be reviewed and initialed after each cycle to ensure the cycle reached the expected parameters. Mechanical cleaners can save time and labor while producing a consistent process. However, remember that the human factors play a significant role in mechanical cleaning. In other words, mechanical cleaners are only as good as their operators. CS technicians must understand how to properly prepare items for cleaning and use each piece of equipment according to instructions. Cleaning chemicals and lubricants. Many types of soil can be present on reusable devices. When soil, especially blood, is allowed to dry prior to cleaning, it becomes difficult to remove. See figure 8.34 for an example of this. Blood flows onto instruments, joints, grooves, and other difficult to clean locations. It then coagulates and dries to create a significant challenge to cleaning. Soil adheres to microscopic irregularities in the surface of instruments and has to be manually and mechanically scrubbed away or chemically treated. Otherwise, it could result in the formation of biofilm. Using proper chemicals in the correct concentrations rehydrates and loosens the soil and helps to properly clean the devices. Each chemical used should be compatible with both a medical device and the equipment used for cleaning. Different types of chemicals are used in the cleaning process, including enzymatic products, detergents, and pre-soaps or pre-cleaning agents. Each has a specific purpose in efficiently processing reusable items. Enzyme products. Enzymatic cleaners and biodegradable non-toxic cleaning agents used to break down soils, stains, and other debris are heavily soiled instruments. They are very helpful for processing difficult to clean devices, such as instruments with lumens. They are also used to keep instruments moist and begin breaking down the soil on instruments immediately after a procedure. Enzymes are very difficult in their action. For example, a protein enzyme will not affect fat molecules. There are different types of enzymatic products available. Some can be used at the point of use to moisten and loosen soil on instruments, and others are used in manual or automatic washing process. Popular enzymes used in CS departments include protease enzymes or protein, break down blood, mucus, feces, and albumin. Lipase or fat, break down fatty deposits such as bone marrow and adipose tissue. Amylase, catalyzes or changes starch. Elements in soil can gradually degrade enzymes during use and reduce their cleaning efficacy. Dried soil on a device must be rehydrated before enzymes that facilitates its removal can be effective. Point of use pre-cleaning, keeping the instruments free of gross soil, can reduce these problems. After pre-cleaning, the instrument should remain moist to keep soil from drying and maintain hydration needed to optimize the enzyme's efficacy. Many enzyme products used in the decontamination are single enzyme products, so it is important to know the type of soil being cleaned. Multi-enzymatic products contain protease for soils, lipase for fats, and amylase for starches. Detergents take longer to clean if they are not used in conjunction with enzyme products. Proper temperature is critical when dealing with enzyme-based products. Temperatures should not exceed 140 degrees Fahrenheit or 60 degrees Celsius, unless otherwise stated by the enzyme manufacturer. Detergents. Since water is not an effective cleaning agent, detergents are used to enhance its cleaning ability. Detergents contain emulsifiers, surfactants, and chelating agents. Definitions: emulsifiers. Any ingredient used to bind together substances that are not normally due not to combine, such as soil and water. Surfactants, a substance that lowers the surface tension of water and increases the solubility of organic compounds. Chelating agents, chemicals that hold hard water minerals in solutions and prevent soaps or detergents from reacting with the minerals. When used properly, detergents penetrate and remove soil from instruments and keep soil in suspension, so it does not reattach to the instrument. Remember that detergents do not kill microorganisms unless they contain a germicide. They help to clean the instrument by removing bacteria-laden soil. Detergents are designed to perform specific tasks. In the home setting, there are different detergents for washing dishes, washing laundry, and cleaning floors. In a similar manner, detergents for decontamination in the healthcare facility are formulated for different applications. Some detergents work in hard water, some are low foaming, so they do not hinder the operation of the mechanical cleaning equipment, and others are developed specifically for a certain type of equipment, like those formulated for ultrasonic cleaners. Detergents also come in several forms. Liquid detergents can be purchased in small quantities for use at a sink or large quantities for use in mechanical washers. Solid forms or blocks of detergents that mix with water as they are dispensed are also available. See Figure 8.35 for an example. Detergents are selected at each facility based on the items and facility's specific cleaning needs, the quality of their water, and the types of soils present. There are several types of detergents that can be used for cleaning surgical instruments. Each has its advantages and disadvantages, so it is important to know how each type of detergent functions and how to properly use them. For instance, neutral detergents are the most commonly used type in the U.S. Neutral detergents have a pH value of 6 to 8. Advantages. Neutral pH detergents are effective on organic and inorganic soils and are safe to use on aluminum products. Disadvantages. Neutral pH detergents are not very effective in hard water, produce more foam, and are more difficult to rinse than other types of detergents. Alkaline detergents are highly effective at removing organic soils such as blood, fat, and oils. Alkaline detergents range in pH from 8 to more than 11. Prior to using an alkaline detergent, refer to the manufacturer's instructions for use. Advantages. Alkaline detergents, they remove a wider range of soil than any other type of detergent, they are economical to use and low foaming. Disadvantages. Alkaline detergents require thoroughly rinsing as they can leave powdery residue on the instrument surface. Alkaline detergents cannot be used on devices made of bronze, copper, or aluminum. Acid detergents are primarily used to remove mineral deposits such as hard water, urine, minerals, and scale. Acid detergents have a pH of 1.6 to 3. Advantages. Excellent for removing mineral deposits in urine. Acid detergents work well on inorganic soils, neutralize alkaline residues, and make stainless steel shine. Disadvantages. Can damage the surfaces of stainless steel and aluminum, bronze, and glass. Disposal into drains and sewage lines may be restricted in some states. Review of common chemicals used in the decontamination area. During the course of any shift, CS technicians must select and properly use several different chemicals. While initial selection of chemicals to be used in the department is done by managers, the technician must select the proper chemical for the job from the chemicals available in the decontamination area. Note, each chemical is different and cannot be substituted for another. See Figure 8.36 for an example. Read labels carefully and ask questions if any information is not understood. The following is a review of chemicals commonly found in the decontamination area. Pre-cleaning chemicals are used in the first step in the decontamination process. Some commonly used pre-cleaning agents are detergent solutions, enzymatic detergents, and combined enzymatic germicide detergents. Pre-cleaning should begin immediately after the completion of any invasive procedure. Blood and other visible debris, if left on an instrument, serve as a reservoir for microbial growth and may damage an instrument's finish. If not removed, the corrosive agents in blood and body tissue can penetrate the protective outer layer of an instrument and cause rusting or pitting of the stainless steel. The manufacturer's directions must be followed when using these pre-cleaning products. Exceeding the time allowed for these instruments to be immersed in the solution can damage or corrode instruments. Pre-cleaning chemicals are applied at point of use, but they may also be used in the decontamination area to keep soil moist and loosen dry soil. Manual cleaning chemicals. These products, when mixed properly, penetrate under the soil and break the bond that attaches the soil to the instruments. Their main function is to remove soil, not kill microorganisms. Low foaming and free rinsing manual cleaners should be used. The manufacturer's instructions for use should be followed for proper dilution and to determine the proper water temperature for their use. Manual cleaners are usually neutral or alkaline products. Mechanical cleaners are specially designed for use in the mechanical cleaning process. They are low foaming and designed to work with a specific mechanical cleaning process, for example, an ultrasonic cleaner. So careful attention must be paid to the manufacturer's instruction for use. Descalars. Descalars are not typically required if the water quality and detergent mixtures are correct and the equipment is operating properly. Still, problems can go unnoticed until a chalky, powdery, hard-to-remove substance appears on the walls of the equipment and sinks. When this occurs, an acidic detergent or descaler is needed to remove the scale. It is important to use a descaling product when scale is detected in the cleaning equipment because scale can interfere with the cleaning ability of the equipment. Lubricants, often called instrument milk because of its milky appearance, are an important part of the instrument maintenance program because they help maintain the integrity of instruments and keep them in good working order. Lubrication is performed after cleaning as one of the final steps in the mechanical wash process, or it can be applied manually in the clean assembly area using a spray bottle. In the past, instrument baths, pans filled with instrument lubricating solution, were commonly used. This process has been discontinued because of increased risk of contamination. Always use lubrication according to the manufacturer's instruction for use to ensure the proper contact time and dilution concentration. Ensure the lubricant is designed for use in the instruments to be cleaned and compatible with the specific sterilization process that will follow. Stain and rust removers are used when the normal cleaning process does not remove stains on the instruments. Stains and rust usually result from improper care, such as soaking the instruments in saline. Stain and rust remover can be used after instrument cleaning to restore the luster to stainless steel instruments. These chemicals remove hard water deposits, rust, scale, and discoloration from instruments and processing equipment. Most stain and rust removers are acid-based compounds, which is 0 to 6.9 pH, that react with minerals and iron on the instruments. They remove mineral and detergent buildup, leaving the surface bright and shiny, and the instruments moving freely. Because these chemicals are acid-based, the IFU must be carefully followed to prevent instrument damage. After using a stain remover, the instruments should be re-cleaned. When using any cleaning chemical, temperature is important. It is an important factor. Most cleaning chemicals deactivate if the temperature is higher than 180 degrees Fahrenheit or 82 degrees Celsius. Unless specified by the manufacturer, cleaning chemicals should never be combined with other chemicals. To prevent instrument damage, the following chemicals should not be used unless recommended by the device manufacturer to clean instruments. Abrasive cleaning compounds, saline, buffered iodine such as betadine, hydrogen peroxide, or any chemical not specifically recommended by the medical device manufacturer. Instructions for use. Knowing and following the manufacturer's instructions for use is a critical component of the decontamination process. CS technicians must understand how to follow the medical device's instruction for use, as well as clearly understand the IFU for any equipment and any chemical they use. Failure to follow an instruction for use can result in a failed decontamination process and damage to instruments and equipment. The remainder of this chapter will examine basic cleaning and decontamination process. Steps in the process of decontamination. The process of decontamination begins with the end user at the point of use, or staff should take the time to ensure that the initial steps of decontamination are performed. The Association for the Advancement of Medical Instrumentation, or AAMI or AMI, and the Association of Perioperative Registered Nurses, AORN or AORN, recommend that instrument users take the time to properly prepare instrumentation for transport to the decontamination area. Soiled receiving. If soiled items are hand-delivered to the decontamination area, the person delivering the items should place them on a cart or countertop designated for receiving the items onto the decontamination area. See Figure 8.37 for an example of this. When carts loaded with soiled items are received, proper body mechanics must be used when handling heavy carts. When loading and unloading carts from dumbwaiters or elevators, check the weight of the cart. Ensure that the wheels are aligned and that they will roll over door spaces or uneven edges. Unload some items to lighten the cart if it is too heavy to move easily. If items are in a closed cart or transport container, open the lid of doors carefully, as items may have shifted during transport. See item 8.3 for an example. Carefully remove items from the cart or container and place them on a flat surface near the sink. Use the following guidelines during the unloading process. Fluid should be disposed of or contained at the point of use. If transported, fluid should be in a leak-proof container. Dispose of any fluids per facility policy. If possible, disposed items in reusable textiles should be removed at the point of use. If this is not feasible, these items should be bagged and sent to the decontamination area. They should not be transported unless contained. See Figure 8.39 for an example. Reusable sharps, including scissors and chisels, should be separated and safely contained at the point of use. Disposable sharps such as scalpel blades and trocars should be removed and discarded at the point of use. If disposable sharps are found in the transport device or in the trays, they should be removed and discarded in an approved sharps container. See Figure 8.40 for an example of this. Carefully remove all tray liners, indicators, filters, and other disposable items left inside the instrument trays. Chapter 8, Part 3. Rigid containers. Remove filter retention plates from rigid containers. Containers and lids should be cleaned without the retention plate and reusable filter in place. Discard disposable filters and clean reusable filters per manufacturer's instructions. See Figure 8.41 for an example of this. If the container system has a valve type closures, the valve should be inspected and cleaned following manufacturer's instructions. Improper cleaning of the container valves can inhibit the sterilant from reaching the instruments to be sterilized. Improper cleaned valves may also lead to contamination of the instruments after sterilization. Interior baskets should be removed from inside the container. Instruments may be mechanically cleaned inside the interior tray after manual preparation. Ensure the transport container or the case cart is completely empty, then clean per the manufacturer's instructions. Cleaning. The cleaning of instruments and other medical devices is the primary function of the decontamination area. It is obvious that instruments should be cleaned after use. However, there are also other times when instruments should be cleaned. See Figure 8.42, which lists some of the circumstances when instruments should be sent to the decontamination area for cleaning. I'm going to read you Figure 8.42. When should instruments be cleaned? Clean instruments after use, after they have been opened, placed on a sterile field, but have not been used. When new instruments are received at the facility. When used instruments returned from repair or refurbishing. When instruments are pulled from backup stock. When instruments are inadvertently contaminated. And finally, when loaner instruments are received. Thoroughly cleaning and adherence to IFUs is important because failure of the cleaning process puts patients and staff at risk. There are several types of cleaning methods. Pre-cleaning. This process should occur at the point of use. Manual cleaning, also known as cleaning by hand. Mechanical cleaning, cleaning items using specialized cleaning equipment. The method of cleaning selected should follow the device or manufacturer's instructions for use. Manual cleaning. Manual cleaning is done to remove soil that was not removed or was often softened during the pre-cleaning process. This is achieved by the use of friction and appropriate cleaning chemicals. Manual cleaning may be performed before the item is mechanically cleaned to ensure blood protein and other soil is removed, when the decontamination area does not have a mechanical method of cleaning, to clean items that cannot be immersed in water, for instruments with lumens, for delicate or complex medical devices such as microsurgical or robotic instruments, and for all items that require manual cleaning as part of their instructions for use. Manual preparation and cleaning process. Set up the work area to accommodate the type of items to be cleaned. For example, for instruments that can be immersed, fill the sink with appropriate cleaning solution. Place heavier instruments in the sink first, followed by lighter, more delicate items. Gently place the items into the sink. Do not pour them into the sink because instruments can damage easily. The items should be placed in the sink in the following manner. Hinged instruments should be placed in the sink fully opened. Multi-part instruments should be disassembled following manufacturer's instructions so all parts of the instrument can be exposed to the cleaning solution. See Figure 8.43. Keep all parts near each other during the cleaning process. Lumens, cannulated items, should be fully submerged, then flushed with cleaning solution. This will force the air bubbles out of the lumens and ensure all inner surfaces are in contact with the cleaning solution. If available, placing lumen items in a vertical soaking cylinder also helps ensure air bubbles are not inside the lumens. Ensure detergents can reach every part of the device being cleaned. If the detergent cannot reach every part of the instrument cannot be thoroughly cleaned. Items that cannot be immersed, like power equipment and many cables and cords, should be set aside to process separately. Many CS departments have a sink area designated for cleaning these non-immersible items. Cleaning procedures for these items will be discussed later in the chapter. Carefully clean the instrument surfaces. Cleaning efforts must be focused and done consistently. Instruments should be brushed in a to and fro motion under the surface of the water. Brushing under the surface of the water prevents aerolization. Aerolization occurs when ultramicroscopic particles are released in the air. See Figure 8.44 for an example. This is a concern because the cleaning solution contains contaminants from the instruments being cleaned. When cleaning, pay special attention to hinges and the tips of instruments because these areas harbor moist soil. All serrated, toothed, or creviced areas should be brushed to ensure the instrument is properly cleaned. Luminated instruments, see figure 8.45, should be carefully cleaned with a brush after soaking in the cleaning solution. Select a brush that fits into the lumen and touches all surfaces. See figure 8.46 for an example. With the lumen instruments under the surface of the water, gently push the brush through the lumen several times. Check the lumen for cleanliness by using a clean brush or an approved non-linting pipe cleaner type product. Because curettes, kerosins, rongers, and other orthopedic instruments can conceal bone and other bioburden, removing material with a bristle brush should be the initial step in the cleaning process. Check all crevices carefully, as blood and bone may be in the areas of the instrument besides the biting or cutting section. See figure 8.47 for an example. Instruments tagged for repair must still be cleaned and decontaminated. When instruments are returned from repair, they must be considered contaminated. See figure 8.48 for an example of tagging. They must be cleaned, decontaminated, and inspected before being returned to the respective sets. Delicate instruments are cleaned, and they are a cleaning challenge. They must be separated from regular or heavy instruments during cleaning. Devices used for delicate surgical procedures are generally lightweight, with fine points and tips. Mixing them with heavy instruments or placing heavy devices on the top of them can cause damage and misalignment. Delicate instruments such as skin hooks can slip through the perforated baskets and become entangled. Check the IFU to ensure the proper cleaning chemical is being used. Unless otherwise stated by the manufacturer, clean these instruments as one would any other surgical instrument, but with more care and handling. Always check IFUs to see if the instrument can be mechanically processed after manual cleaning. If processing in a washer disinfector, a delicate cycle will probably need to be selected. Ophthalmic instruments have special cleaning protocols because of the increasing incidence of toxic anterior segment syndrome, or TASS. Manufacturer cleaning instructions must be carefully followed. It is recommended that facilities have sufficient instrumentation to allow adequate time for processing between patients. Definition: toxic anterior segment syndrome, or TASS. Acute postoperative inflammatory reaction in which a non-infectious substance enters the anterior segment and induces toxic damage to the intraocular tissues. TASS precautions in the decontamination area. TASS occurs when contaminants enter the eye during eye surgery. Those contaminants can be the result of inadequate instrumentation processing. The risk of TASS can be reduced in the decontamination area by the following. Carefully following all manufacturer's instructions for use in cleaning. Taking actions to prevent the formation of biofilm on instruments. Using only enzymes and detergents recommended for the manufacturer. Keeping cleaning tools such as brushes and syringes clean. Flushing lumens. Copious rinsing with the recommended rinsed water. Note: be sure to follow the facility's specific protocols for processing eye instruments. Pay attention to detail and do not take shortcuts at any step in the process. There are thousands of instruments on the market, and cleaning each one requires specific knowledge. Instruments that are designed to perform the same function but are made by different manufacturers may need different cleaning process. Consult the device manufacturer for the special considerations and to determine if these devices can withstand automated washers. Chapter 8, Part 4. Orthopedic and neurologic surgery has many instrument sets that require extended preparation and inspection prior to and during cleaning. Joint replacement, cutting guides, rasps, reamers, and broaches hide gross amount of blood, bone, and tissue. See figure 849 for an example. This can occur even with the best point of use care in the operating room, and these instruments must be cleaned with brushes and extensive hand detailing. Pre-soaking with enzymatic detergents can help remove much of the bioburden from the crevices. Some washer manufacturers have designed special washer racks to hold and flush out these devices. Laparoscopic and robotic instrumentation can be difficult and time-consuming to clean. The instrument manufacturers provide extensive cleaning instructions. These instructions must be carefully followed to ensure the instruments are clean. Always use properly sized brushes in the illumined area and carefully follow any flushing instructions provided by the manufacturer. For example, these instruments, especially robotic instruments, can be damaged if too much air and water pressure is used. Some types of mechanical cleaning equipment can have special baskets, manifolds, or connections to flush these items during mechanical cleaning. These items must be still be manually cleaned and flushed, even when using a mechanical method. Flexible and rigid endoscopes also pose special cleaning concerns. Endoscope cleaning and decontamination is discussed separately in Chapter 11. New or repaired instruments received in the central sterile department must be cleaned prior to the disinfection or sterilization. Although these instruments may look clean, their surfaces are covered in fine metal dust, oils, and other debris from manufacturing and repair process. These instruments have also been handled and exposed to outside elements during shipping. Instruments from backup stock should be cleaned prior to use because they have been hanging on walls and stored in drawers for some time. These instruments could have been handled multiple times and most likely contain dust and other environmental contaminants. See Figure 8.50 for an example. Cleaning instruments that cannot be immersed. Instruments such as power equipment and cameras cannot be immersed in water. The device manufacturer's instruction for use should be reviewed to ensure proper cleaning chemistries and cleaning methods are used. Hoses and cords should be carefully wiped down using the approved solution in a clean soft cloth. Special care should be taken at the end of hoses and cords because water will damage these items. Many of these types of instruments are dark color, which makes it difficult to see dried blood, so meticulous attention must be paid to cleaning these items. See Figure 8.51. Unless approved by the manufacturer, do not rinse these items under running water. Carefully check these items to ensure there are no nicks, breaks, or tears in other outer coverings. If any damage is noted, mark the item for repair prior to sending it into the assembly area. Power equipment presents challenges to central sterile technicians. These devices are powered by batteries, pneumatic air, or electricity. Care should be taken to prevent exposure of the connection points and battery contacts to moisture or chemicals. These connection areas can react with chemicals and cause damage and loss of electrical contact with the power source. The use of battery, hose, or cable designated for the decontamination area will help keep these connections dry. See Figure 8.52 for an example. Note, Chapter 11 provides a more detailed discussion on cleaning power instrumentation. Cannulated drills have their lumens cleaned with running tap water, if approved by the manufacturer, and they should be brushed with a soft brush. See Figure 8.53 for an example. A plastic syringe filled with water and enzymatic detergent can assist in delivering cleaning agents to hard-to-reach areas. If the instrument cannot be cleaned under running water, use a soft cloth, appropriately sized brushes, and syringes filled with cleaning and rinsing solutions. Orthopedic saws frequently have residual bone chips and impacted bioburden in their working parts. They must be flushed and brushed clean under running water if approved by the manufacturer. Power accessories such as chucks can usually be immersed in the cleaning solution. However, some may need to be hand processed without immersion. Drill and saw attachments need non-immersion cleaning. Consult and follow the manufacturer's instruction for use for the proper cleaning method. Cleaning instrument containers and basins. Cleaning rigid instrument containers and basins requires procedures that differ from those used in instruments. A neutral pH detergent is usually recommended because acidic or alkaline pH detergents will damage aluminum and some composite materials. If processing manually, carefully clean all surface areas while the item is immersed in the cleaning solution. Rinse with softened water, then with pure water. If cleaning, these items mechanically place on the appropriate rack or manifold. When cleaning containers, the filter retention plate should be removed and not processed attached to the container or lid. Handle locking mechanisms in container rims should be inspected for cracks and missing components. If basins are dented or bent, or if containers are damaged, mark them for repair or removal from service prior to sending them to the assembly area. Mobile patient care equipment. Mobile patient care equipment has different processing needs than surgical instrumentation. In general, the use of mild cleaning agents and disinfectants can be utilized to clean exterior components of patient care equipment. Use of an incorrect cleaning agent may affect product warranties and device functionality. Some chemicals may cause cosmetic changes in plastic and other materials. Some devices have access doors and hatches that must be opened to clean intricate parts. See Figure 8.54 for an example of this. Extreme care is needed to avoid damage to these critical parts. Soft materials and applicators may be used to clean these areas. Care must also be taken to thoroughly clean around switches and cords. It is important that the cleaning cloth is not overly wet, dripping, as water may damage the equipment. CS technicians must clean many pieces of mobile equipment, including isolation and special procedure carts. Carts must be cleaned after each use. Do not empty the inside drawers of these carts while they are in the decontamination area, because this would expose the supplies in the carts to the area's bioburden. Carts should be emptied before transport. Transport the cart to the decontamination area and clean all surfaces inside and out. Then transport the cart to a clean room and complete the restocking tasks. Inspection. CS technicians play one of the most important roles in the next step of the decontamination process of inspection. It is a crucial step in the process because this step helps ensure the safety of themselves, their co-workers, and the patient. Each item cleaned must be carefully inspected for visible debris. If debris is found, then the item should be cleaned again according to the manufacturer's instruction for use. Quality testing. There are several devices available to inspect instruments for cleanliness. Some examples were shared at the beginning of this chapter. See figures 8.2, 8.3, and 8.4 for examples. Another method commonly used to check the instruments for cleanliness is a swabbing process, where an item has been cleaned and is swabbed, and the swab is then processed to determine if there's residual soil present. See figure 8.55 for an example of this. Decontamination. The decontamination process involves the use of physical or chemical procedures to remove inactive or destroy bloodborne pathogens on an item's surface. The purpose of decontamination is to make a device safe for people who are not wearing gloves and to reduce the bioburden to make the next processing steps easier. Some instruments are safe for handling after they have been thoroughly cleaned. However, others require exposure to a microbial process. Require exposure to a microbicidal process. Thermal and chemical disinfection are discussed in detail in Chapter 9. Conclusion. Cleaning is a complex multi-step process. The success of disinfection and sterilization process depends on a successful cleaning process. Central service technicians must understand the cleaning process for each medical device and perform it consistently to help ensure the safety of patients, visitors, and healthcare personnel. Terms to remember: cleaning, decontamination area, relative humidity, biohazardous waste, deionized water or DI, distilled water, reverse osmosis or RO, pyrogen, cavitation, impingement, emulsifier, surfactant, chelating agents, toxic interior segment syndrome or TASS,